Oh, no. Well, how you feeling?
I feel good.
Any headaches?
No,
Nothing like that?
mm-mm.
How's getting around?
It's okay. Sometimes I forget the cane,
Mm-hmm.
but I try to remember to use it just in case.
Outside, he doesn't use it in the house.
Okay.
But
But
I
no,
don't
no
use it
falling,
now.
nothing like that?
No.
Weakness in the legs or arms? Because you're having some pretty pronounced weakness before at times.
This hand here,
Boy,
Is it
it's
still a
so,
little clumsy?
you know, that's so strong. When he gets a hold of me, that arm is so strong. He doesn't even know he's doing
Give
it,
me a good grip.
and I have to take it away from him.
Pretty good grip. Now hold both hands up. Kind of tap your fingers like that.
oh,
And alternate fingers. Okay. Oh, it's pretty good.
but this one here, sometimes I'll pick up something and I look and I don't have it. It's
Yeah.
laying on the floor.
Yeah, I think it's got a little bit of what's called apraxia. And apraxia is an issue where it's if you're not really paying attention to it, it just kind
Yes.
of does its own thing and
That's
let
what
go
they
of it.
told
And that's what your occupational therapist said.
Yes, you have to watch.
So you need to
You
tell,
should
your brain needs to
keep
tell
it-
your,
keep control of
right.
making sure it's focusing on it.
Mm-hmm.
Okay.
That's what he said.
So everything looks really good.
Amen.
So here's the MRI that you had done. What was the date on this one? September 1st, so just a couple days ago, right?
Yeah.
Mhm.
So the areas that we were watching, the little fingers that go up here, that we did not get, but that we did the radiation for, right?
Mhm. Mhm.
So all those areas are the ones that we were looking at, and all of them look pretty darn stable. The whole volume is overall down, right? So we had kind of cored out that whole center portion, cored out some of the stuff up here, and then went in and did the deep portion a little bit. But all that looks pretty good. You can see that the bulk is a lot less here. If you look, let me pull this side by side here. Let's see. Let's switch that one out. Okay, so let's do side by side here. So this was the one from before, right? After the surgery, but before the radiation chemotherapy. So that's what it looks like here. There's a lot of blood products in there from surgery and everything, but these were the ones that we were keeping on, these little fingers that were going up. And overall, those look pretty stable. I mean, they're not advancing, they're not really going anywhere. They look pretty good.
Good.
Not a lot of progression. There's this little area that's the deep portion here that goes down to the ventricle that I think we're just gonna have to keep an eye on. It was hard to really see it at this point because it was being so compressed. That whole side of the brain was being so pushed over and squeezed over that I don't think we were seeing much of it. So it, all things considered, looks really good.
Good.
Great.
Okay, it's not advancing, it's not changing a whole lot, at least at this point it looks fairly stable. The brain has now kind of bounced back to its normal configuration. It's not being squeezed over and compressed like it was before, so that's obviously a lot of the improvement that you've got in your hand function. The speech is better overall. So I'm happy about it.
We are
Good.
too.
I think it looks pretty good.
So then this hand will start getting better as time goes by.
I think with the therapy, I think it will.
Good.
Okay. The things to so radiation is done.
Mhm. Yes.
Totally done.
Everything's
All
done.
okay. And then you did the one cycle of Temodar.
Yeah,
Just
last
done the one
night.
cycle of Temodar. Okay.
That's pretty
You
powerful.
just started.
It is.
You just started your second chemo med.
Right.
Yes.
So now you're on cycle 2.
Right.
Okay. So for now, we just kind of keep an eye on you.
Good.
I think the issue with the Temodar is staying on it. It's a pretty well tolerated medication, although it can have some side effects, make people a little sleepy, a little loopy. But I think
So he's loopy anyway. But I was going to ask you about that.
Sure.
Timothy. I know you increased it, and so I give it to him at 8 o'clock at night, so that it said 3 hours, 2 or 3 hours after you eat.
okay.
So I give it to him just before he goes to bed. He went to the bathroom quite a few times during the night, but I didn't bother that. And he did spit up a couple times, but I knew it said you could vomit, you could do these different things, and, you know, before you gave me something to take an hour beforehand to prevent this,
Zofran?
but I don't have that this
Anti-nausea.
time.
Okay. Who is he going through oncology? Is it Williams?
Cherry.
Cherry?
Cherry.
Okay. Give their office a call.
Mhm.
Because if he's still having some nausea after taking it, then he'll need that Zofran again.
That's what I figured, I
Yeah.
thought, well, maybe they just didn't send it
They
to
probably
me.
just didn't think of it.
Yeah, so, no, thank you, that's
I
good.
just reminded him to
Mhm.
say we need another prescription, so they'll do an ongoing prescription for it.
Okay, alright.
Especially if it helps you prevent it from throwing it up. Obviously, if you're taking it and you throw it back up, it's not gonna do you any good.
No,
You're
that's
not
what
getting-
I
You're not
said.
getting your chemotherapy, so.
Mhm.
Right.
So stay on the Temodar. I think all in all, it looks pretty
And he
good.
just
Great.
takes that for 5 days, doesn't he?
Just 5 days.
I don't know what the course is. I mean, usually they'll
Just
kind of
5
weigh it out
days.
by, size and mass, and then he'll do a couple sessions on it, so it's a
Oh,
couple,
okay.
5 days on,
And then the whole
14
month.
days off, or 15 days off, and then 5 days
Right.
on. So it's intermittent. What you're trying to do is let it kind of get back on its feet and then kill it again. So it's just kind of this repetitive
Okay.
cycle. Rather than just
Right.
going, doing it, we found that by giving these little breaks, it improves things.
Okay,
But I
Excellent.
was working like 6 hours a day, now I've sort of calmed down to maybe 4.
Right.
Good.
Just try to take
take it easy for a
It's
little
hard
bit.
to not work.
you keep saying, the doctor told me I had to rest, so that's
Yeah.
what
Yes.
made him do
Good.
that.
So that's making me do that since you
Good.
told me.
Good.
I don't listen to her.
All right.
Do you think you should be doing physical therapy or occupational therapy?
I think you should.
He's through with that now.
Okay. Do you have the exercises they gave you at home to
Yes,
do?
mhm.
Okay. Do that. I would keep doing those. If you kind of get to a plateau and nothing's really, well, I mean, then you kind of have to assess, well, does he need it any
Okay.
further if he's kind of plateauing? If he's getting around okay and he's not having much problems with tripping or catching his feet,
No,
then I
he's
think
had
he's
no
okay.
problem.
Balance is okay. I think it's all right. As long as you're using the cane when you're out and about.
And he's eating good,
Good.
he's eating good.
Excellent.
And the only time I use a cane is when I go outside usually.
Okay.
Inside I haven't been using it.
That's fine. Like I said,
Okay.
you usually got walls to
Yeah,
catch on
that's
to if you're.
yeah.
Yeah.
It's more just a balance issue. It's not a weakness type of a problem. It's more.
Yeah.
I worry about that foot catching. It's kind of like your hand. If you're not paying attention to it, it'll
Yeah.
tend to drag a little bit. So if you're getting tired, just make sure you get rid of rugs and stuff like that.
Yeah,
Places
that's
where
what
you
we
can catch
did.
your feet.
Mhm.
True.
Okay.
Good.
Yeah.
Right. Very good.
So I still want to repeat this again in about 3 months.
Okay.
Obviously, if things change. We know these are aggressive tumors,
Mhm.
right? Even if he's on the Temodar, it can
Mhm.
come back.
Yeah.
It can progress. It can advance. So if he starts having any issues or things that are concerning, call us. Okay, we may bump things